The next strategy number one is going to be a panel about criminal justice. After that, we will have some time for a break and some networking, and then we'll be on with the rest of our presentation. So up now is Courtney, Tyler, Maia, all from Sunrise up in Bochum County, and they are doing a masterful job with this. So get out your paper and your pencil and listen up. All right, everyone ready?
Good morning, everyone. I hope everyone's doing good this morning. It's cold and rainy up here in the mountains. So I'm just going to kind of do a brief overview of our program, the community linkages to care, and then I will introduce Tyler, who is currently our coordinator of the program, who's also has some experience being a participant as well. And then Maia will speak on our MAT program that is housed in our jail. So just a little bit about who I am. My name is Courtney Lytle. I'm a person in long-term sustained recovery from substances, mental health struggles, and a survivor of domestic violence. I am a peer support specialist and a recovery coach for Sunrise Community for Recovery and Wellness in Asheville, and I am the operations director. So about 2.5 years ago, CLC was started. It is housed in Health and Human Services at the county and staffed by peer support specialists with Sunrise. Over the last 2.5 years, the program has been a huge success, and it has had a huge impact on our community, specifically those re-entering from jails and prisons. Obviously, there's strong evidence that individuals who discharge from jail or prison with substance use disorder not only have higher risk for overdose, but additional barriers for establishing safety, stability, once they re-enter the community. So our peer support specialists are able to provide immediate wraparound services prior to release and also once released. And this is ideally it happens prior to, so we're able to kind of establish a plan once they're released, but a lot of times we are linked with folks after they have already released and we are still able to serve as well. The only requirement for the program is they have to have been released in the last 90 days and they have to be residing in Buncombe County. And what that looks like is even if they have been incarcerated in a different state or a different county, but the plan is to come reside in Buncombe, they still qualify. So currently Linkage receives referrals from everywhere, but to list a few, state prisons, treatment centers, outreach efforts, halfway houses, day centers. We receive referrals from our MAT program at the jail, the post-overdose response team, which is also known as PORT, and then also many other community-based organizations. We do work directly with what Maia is going to talk about in a little bit, but we do receive direct referrals from the jail from individuals who engage in MAT services while they are housed at Buncombe County, but maybe don't qualify for the community piece that the MAT program provides. So folks who are coming into the jail and are already on MAT meds in the community, but the jail is just continuing them while they're being housed or referred straight to the Linkage to Care program. And I say that to say that there's a big, like I would say on average, we get around 20-ish a month referrals directly from the jail. So we've kind of turned into kind of the catch-all for the population that we serve. And this program is unlike a lot of reentry programs. So a lot of times people think of reentry, they think of like the courthouse, they think of parole, probation, and those types of things. This program is completely community-based, and it is focused in harm reduction, meaning that we meet people exactly where they're at, regardless of their situation. So we have a pot of money called Social Determinants of Health pot of money that is able to purchase different things for folks and also allows for housing sober living housing most of the time. But I say that to say that a lot of times we have folks that are, want to go the recovery route, want to go into sober living, but we also have people who maybe that's not what they're trying to do. Maybe they are outside and they just need a tent and sleeping bag, and we're also able to provide that for them as well. And so because we are a harm reduction program, there's no requirements. It is up to the individual what they want to make of the program. It is a self-referral. So yes, we receive referrals from a lot of different places, but it's up to the participant to kind of engage in the services, and they make it whatever they're needing. So the current outcomes reflects that, the evidence-based practice of harm reduction within the programming has fostered strong positive engagement from participants. So by not creating barriers and supporting people exactly where they're at, we've been able to really build strong engagement and rapport with our participants. So since the start of the program, we've received 478 referrals. We've completed 285 intakes. We've been able to connect 124 people to medicated assistant treatment. 119 people have been connected to transportation services. 124 people have been engaged in primary care. 82 people have maintained housing, and these are folks that once they engaged in linkage, they had no housing at all. 52 people linked with harm reduction services. So whether that be our SSP that we operate, which is a syringe service program at our local health department, or other harm reduction services in the community. And then we also have been able to provide Buncombe County Detention Facility with 1,325 naloxone upon release. So that was one of the goals of the program in the beginning, was to be able to provide each individual who wanted access to Narcan when they were being released from the facility with a kit. And so we've been able to provide 1,325 of those. We currently have around 94 active participants, and of the 94, over 51 have remained connected to the program for over a year, and some of them closer to 2. So again, that goes back to really speaking on that harm reduction model of meeting people where they're at, that people are really, like, let's say someone's going back to jail, they're remembering that phone number to contact to re-engage in services once they're released. And so let's see. And just one more piece to add, we have a lot of overlap between some of our other community-based programs. So a lot of times we have participants that are in Maia's program at the jail, and then they're connected with linkage once they're released. And maybe they encountered the post-overdose response team at some point during the journey, and maybe they also accessed the SSP at the health department. And the key piece is they continue to reach out for support to one of us at all times during their journey. And that speaks on the power of peer support, because all the people that are working in the programs are peer supports and recovery coaches. We get it, we've been there, and it creates this like even playing field where folks are comfortable engaging in services without the fear of stigma and judgment and worrying about having to take a drug test, or they're going to get kicked out of a program, or worried about violating parole or probation. People aren't looking for mandated services. They're just looking for programs that provide them support to continue on their journey to wellness, whatever that may look like for each person. So with all of that, I feel like that was a lot. I will introduce Tyler. Tyler is currently our Linkage to Care coordinator. He has a lot of amazing full circle stuff happening, and I will let him take it away.
Hello, good morning, everyone. My name is Tyler, Linkage to Care coordinator. A little bit about myself and why this position I'm so passionate about. So I'm a native of Buncombe County, 30 years old. And my journey began when I went off to college. When I went to college, opiates came into the picture for me. I was I was on a golf scholarship. And when opiates came into the scene, that's kind of when my life shifted. I got my first overdose, the first of many. And due to my drug addiction, you know, I didn't finish college. I dropped out, moved back into Buncombe County. I became a participant of port because I got to where I was using drugs intravenously, and I was overdosing once a week, and I continued that path, getting locked up multiple times along the way. I would go into our jail system, spend 4, 5, 6 months at a time, get out. And you know, the whole time I was locked up, I would be thinking, you know, how can I do it smarter? You know, because a big portion, like jail, is supposed to be about reform. You want people to learn from their mistakes and not come back. And I was missing that reform piece. It was mostly just a punishment. I'll do my time. I would get no skills. I would get no ideas about recovery, and I would just be released and back into the same toxic environment I was in before. And I continued that cycle. The last time I got locked up, that's when I had contact with Sunrise Linkage to Care. And this was the big difference, and this is the impact, is when you touch somebody at such a vulnerable spot. You know, when people go to jail, they get clean. They have time to think about their next steps, you know, positive thinking, maybe about a job, maybe about, you know, a lot of people didn't have housing. And that is where we get to come in. You know, if people have a release date, we can start going into the jail, talking to them, spreading positivity, speaking from the heart, because I was there many times, and letting them know that they have someone in their corner that cares about their well-being. Many people don't have families, so that is a breakthrough. We get to talk about, you know, shelter. For me, it was Oxford House, which was a huge blessing, and I send as many people as we can get in all the time. And we send them to, you know, not just Oxford, there's sober living houses, many of them in Buncombe County. And once we get them into a stable environment, that's, you know, routine was key for me. You know, a job, help them find something to give them a sense of purpose, to have, so they can depend on themselves. They don't have to depend on us, don't have to depend on anyone else. We want them to be stable. We help them off gate with some work clothes, help them get back and forth to work. And let's see, recovery groups, this was a major thing for me. Because when I was locked up for, you know, I had been in drug addiction for a decade. So I didn't know the first thing about sobriety. I was clean the first part of my life, and then I was using drugs. Like, there was no sober living, there was no brotherhood. I wasn't connected to anyone except for negativity, you know, people using, or people who have never used. So there was no middle ground. And that is a major thing, getting a brotherhood or a sisterhood for a participant, someone that they feel comfortable, you know, sharing their struggles, someone they can bounce ideas off of, someone they can relate with, made all the difference for me. And And we're seeing a bunch of major victories, you know, people for the first time going through our program, getting into housing, getting a job. And, you know, I count it as a blessing when I don't hear from that person anymore, because I know they're doing well, that they got them a bank account now, they're getting back and forth to work. It's incredible. And another thing, I'll get people calling me for one-on-ones, you know, and that's another thing that this program does. Someone who has walked in their footsteps, someone that knows their thoughts and what's going on, and someone that can help them, like myself. So we'll meet up, talk about things I've been through, and just bounce ideas off each other and try to guide them on the best path to recovery and just to continue moving forward. And I appreciate you guys listening to me. Thank you.
Maia.
Hi, my name is Maia Hughes, and I am a person in long-term recovery from substance use and mental health. I have been the MAT coordinator with the Buncombe County Detention Facility, so contracted with them for the last year and a half. I'm actually in the process of transitioning out, but it's been more than an honor and a blessing to be a part of the program. So I'm I could probably talk about this for 2 hours, but I'm not gonna do that. I'm just gonna kind of give a brief rundown. So when people get arrested, when they go through medical intake, they are asked if they are currently on MAT through a clinic, or meaning Subutex, Suboxone, Methadone, or if they, you know, have an issue with any type of opioids. If they say that they have been at a clinic, then and actively dosing at that clinic, then medical staff, the MAT nurse at the jail, gives them a drug test, and if it's positive for that, then they will continue to dose Subutex while in the jail. I'm sure most people in here are aware of the difference between Subutex and Suboxone. We offer Subutex, that is not the dual product. So the dual is Suboxone, that has the blocker. We offer the one that does not have the blocker. So they will continue to dose the whole time that they're in there. And I noted also the program has like changed and evolved as the participants' needs have changed and evolved. So we've had lots and lots of staffing meetings, and at one point we were only able to dose up to 90 days unless they had a set release date. Now, which I absolutely love, it's not like that anymore. So if you were established at a clinic and you were dosing there, then you can dose as long as you're in Buncombe County Jail. If you were on methadone, you would have to transition. So, or you don't have to. We have the peer will have like a one-on-one conversation with the doctor, the medical staff, because I'm not medical staff, I'm just peer support. But yeah, they have a conversation about what the transition will look like. Unless the person has comorbidities or it is a pregnant woman, then they will continue dosing methadone. The risks are too high for them to transition. And if people have a set release date, so if participants are arrested and I go through and I scan through release dates, sometimes they don't even know the release date's in there. And if it's 2 or 3 months away, then the MAT nurse can start dosing them 2 to 4 weeks before their release date. So it's built up in their system. Every person who meets with, so they have the history and physical with the doctor, and what the peer support does is like the pre-H&P. So I would go down to the units introduce myself, build that rapport, and let them know, hey, I had been to jail a lot when I was using prostitution, using, in and out of jail, losing my kid, living on the street. All of those things were, and MAT were a huge part of my story. So it can be challenging because you want to sit and talk for a very long time. You're trying to build, as much rapport as you can in a shorter allotted amount of time, but people are still like very receptive. And that's the big part with peer support is, just the light in their eyes when you let them, pretty much when they see that somebody who's been exactly where they are is sitting in the jail now willingly and not, they're not in there because of charges. So I make sure that they know that I'm no better than them. I don't judge. I meet people where they're at, and let them know that, it takes time, but people are there to support them and that they can get all of these things back too. So the pre-H&Ps, we enter, people can put in self-referrals. So sometimes they can do it through the kiosk, which I would check multiple times daily. And it's, hey, I'm interested in the MAT program. I would jot all of those names down. Thankfully, the jail was, everybody at the jail was, fairly receptive, and there weren't issues with me having that kind of the access to the units and to directly interact with the peers, and for me to have access to the jail kiosk, which medical, that was mainly for medical. So I would get referrals through there, through self-referrals during medical intake. If they did express that they had been on MAT or that they were an opioid user, it would trigger a Sunrise self-referral that they would fill out. So during the pre-H&Ps, talk to them for a minute, go over the self-referral, which is kind of like, hey, do you need birth certificate, ID, social security card? Is a halfway house something that you're interested in? Do you need a phone? Do you need clothes? Do you need hygiene stuff? Just so when the community peer, and that's evolved also. We have the peer that's kind of in the jail and then the community peer. That way, when I scan those referrals over to the community peer, they can glance at it and they kind of already have a heads up as to what that participant is going to need. Sometimes I have participants, again, we meet people where they're at that, and it's harm reduction. I've had participants tell me, I don't want to, use fentanyl anymore, but I'm going to continue to use meth. So we talk about different meetings or support groups that they can, what we can do to meet their goals specifically, even if that's just not using IV anymore or switching substances, if that's getting, a phone and a tent, what was previously shared. So we have the building the rapport, the pre-H&Ps, then some, we do Gippers and apricots, and then they are brought up, and I was able to actually go down to the units. So I would go down to the units with my laptop and ask the COs. I was able to go in the programs room and have a one-on-one with them, which was very, very helpful. It wasn't like, it hadn't always been like that during COVID. So sometimes they were actually brought up. Later in the day, they go and meet with the doctor, who's amazing. And the MAT nurse who's currently there is amazing also. But yeah, so they go up and they meet with the doctor. And once they have met with myself and the doctor, they are considered a part of the MAT program. Now, people who, let's say people don't get to dose. Let's say they come in and they were not established at a clinic. They're not transitioning. They don't have a release date. None of that. Unfortunately, they don't get to dose before they are released, but they will all be released with 5 days, a 5-day supply of the Subutex regardless. So that way, when they get out, or, right when they walk out the door, they can take that medication, and then they will reach out to myself or the community peer. And that gives us a 5-day timeline to be able to get them linked up with a clinic, or sometimes call Dr. G from the jail and have him write a bridge script, because we all know that clinics get backed up and sometimes they can't be seen for 2 weeks, and that's just too long. So we can help pay for up to, 3 months of halfway house, phones, get them some clothes, start to build a little foundation. Like Tyler said, one-on-ones. I've met people, we've gone to Ingalls and gotten subs and then just gone for a walk or sat by the lake to talk about things. I've seen, I just actually last week, I think when I was using, a lot of people were probably didn't think I was going to make it. Let's say that. And I have to be careful too, because obviously I'm human. So sometimes I'll meet with somebody and I'm like, oh, I don't know if they're going to get this. And, and then they do. And that's the most beautiful part about it is one of the last peers that I met with last week got into halfway. She met with her daughter for the first time in 8 years. She's built a connection with the women in her halfway house. She's set on her MAT. She's doing IOP, looking for part-time work. And because of like the small things that we were able to provide and help with, she didn't have to get to the halfway house and worry about finding work that very day and paying for it immediately. So, there are lots of victories. And then the tragic part about it is that, a lot of people die, which is why this program is so important. And which is why, if I had it my way, the director of the program at the jail asked me last week if I could change anything about the program, what would it be? And I told her to just give everybody subutex that wanted it, and obviously there's, politics and rules and regulations behind that, but so many people are dying. I have it highlighted. I track everybody that I meet with so we can, with their booking numbers, so I can see, or so the director can check the recidivism rate, how many times each person has been in there. And everybody highlighted in red, those are people that have passed away, some that I have known since, for 10 years when I was still actively using. So I think that we've had a lot of progress, but a lot still needs to be made. And that's the goal in the Buncombe County Jail too, is to make some changes where all forms of MAT can be, accessed easier. And then we were also doing groups. So where eventually we would like to do it on every single unit. We had just started off on the women's unit, going in there and running a peer support group once a week, which was super cool and super helpful. Courtney had already shared briefly anybody. So we did get a lot of referrals in the jail where the participants, we would get the referrals, but they had bonded out or gotten released before I was able to meet with them or Dr. Goen. If that's the case, then they are not considered with our program because they didn't meet with us. So that's when we refer them to Linkage to Care, which is, who Tyler's the coordinator for. So it's really, I love that people work together. We're, harm reduction, and we meet people where they're at, but it's important too. There were other programs in the jail that we would be in touch with also, often, like where somebody would, this participant told me that you guys were able to pay for 3 months at a halfway house, we can do a phone. So like if we didn't have the phones, making sure that, all of their needs were met, which was super, super cool. And I'm trying to think if there's, so the only other thing that I can really think of that I'm really grateful for was medical staff, and then a good bit of the detention facility was, yes, there's still stigma. I'm sure of it, but those were challenges with, the turnover rate and medical sometimes was medical staff not understanding why people wanted subutex, or anybody for that matter, just automatically assuming that participants are drug seeking, or they shouldn't get these, or they're going to divert, or they're going to do this or that. Well, yeah, I mean, that might happen sometimes, but it, coming from me as a person in long-term recovery, you're not only are you trying to do anything to not feel physically ill, but who are we to decide whether or not somebody's ready and whether or not that's something that they genuinely need in order to live a fulfilling and successful life. So I think I was very, very fortunate that I was just in a spot where the majority of people were very accepting of this. And yeah, I love what I've been doing for the past year and a half. And I think that easier access to MAT is just really important. A lot of places you have to daily dose, or which I get that too. None of this stuff is going to change overnight, but it can be difficult when you have somebody who's kind of on maybe a little ambivalent about whether or not they want MAT, or whether or not they want to be totally abstinent, but they don't even get the opportunity because you have to daily dose and, you know, do all of these things. And yeah, I understand that it goes a lot deeper than that. It's not just as simple as giving people MAT and letting everybody dose that wants to. But if we could find some common area or compromise to make it a little bit easier, I think that a lot more lives could be saved. And I'm just tired of seeing people that I care about die. So yeah, that's a brief rundown. And I think that's all I have. So thank you.
Thank you, Maya. And just real quick, before we wrap up, I feel like it's a lot of information and people are probably like, how do I do this? How do I do that? And I just wanted to say a couple key points is I know community buy-in. And so for all the programs that we've talked about, so with the jail, Sarah Gayton, who is the director of it on the detention side of things, having someone on the inside that is advocating for the peer supports, the harm reduction model, the meeting people where they're at, the understanding the value that peer support holds in the space, and how when running programs like this, you know, we're the experts, right? We get it. We've been there. Like Maya said, you know, she sat in Buncombe County. Like Tyler said, he sat in Buncombe County, and who better to ask those questions about what the participants need than those people. And so I really feel like having people on the inside that can kind of, because we all know it's political, there's things that kind of have to be moved around that nonprofits and community people don't have access to. And so having those is key. We have the same thing at the health department. Amy Upham is who worked really closely with the state to get linkage up and going, and, you know, housed at the health department and contracted out. And so finding those people in those county positions to really push that peer support, that contracting out, why it makes sense to contract out with a nonprofit that's doing the work already rather than hiring someone in-house to do the work, why that's so essential, why it's essential to have community programming rather than keeping it in-house only, and what that is like, I can't put an emphasis on how important that piece is. And then also the part of finding funding. So with linkage specifically, it was originally, one part of it is a state grant through the Injury and Violence Prevention Branch. And then that piece, once we started it, we realized, oh my gosh, I was the only peer support at the time. I was in the only peer role. And so it was just me by myself. And I realized within about, I don't know, 5-6 months that it was not going to be able to get done efficiently by myself. And so we advocated with Dogwood Health Trust to get another position. And so currently there's 2 funding streams for the linkage to care. And then the MAP program is state funding. And I think it's really that community buy-in, talking about it, you know, putting the right people at the table to advocate for the services. I can't say it enough how important that is. And yeah, I think that's it. Sue, I don't know if you have anything. Marilyn, if you have questions.
I just want to say thank you all. So very proud of you all. And I mean, I know we're out here doing that work, but to just sit and listen and absorb what's happening and going on, it's a big shout out to you all. And thank you to all of our community. It takes a lot of community buy-in, right? So Buncombe, in my opinion, is like progressive in how we do things, and you know, we're known as like the recovery resource rich area, and then you know, we work regionally, so we cover over half the state, from Charlotte west, and we go into some of our other communities and they have absolutely nothing, and people are dying, you know, and it's just amazing. And I just wish that every single community, every county, every town had recovery support services available. And a lot of that is, again, community buy-in. We still have people that are just really stuck with stigma. And we've done, I can look back 5 years ago compared to now, and wow, there's been amazing work done. Peer support is blown up, recovery supports blowing up, but we still need them. We need them everywhere. And then, yeah, I don't know. Courtney and Maia, what would you say are the key advantages for these programs for each or both? Besides, I mean, saving lives, changing lives, to me is pretty top notch, but what are some other things that come to mind for key advantages?
I think one of the biggest one is reducing recidivism. The numbers of participants that are engaging in services and not going back to jail or prison is extremely high. And then also just that, people are having support regardless of what they're choosing to do with their wellness. And you can't, that means that people are living and not dying, and they feel comfortable with their peers that they're working with. And I know for me, when I was in active addiction, I think Tyler spoke a little bit on this, you don't have real relationships, right? It's all superficial. And so when you enter this world of someone's coming to you and asking what your needs are and not telling you what you need to do, it's empowering to have someone just truly support you regardless of what's going on. And I don't, that's an advantage at the very top.
Mm-hmm. Agreed. And real quick too, I'm sorry. So I'm Sue Polston. I'm also a person in long-term recovery from substance use, mental health challenges, unhealthy relationships. I've kind of been through the whole thing. I've lost a child to death, and then I lost 2 children to DSS. I regained custody back. I lost a parent to an overdose that I actively used with. I mean, I have trillions of experiences. Unfortunately and fortunately, because it gives me the ability to do the work that I'm able to do and to emphasize it and just be able to relate. Like Courtney said, I've been there, done that. It's just amazing when I go into the jail. Pre-COVID, was going into the jail to bring groups in, and this was before our jail programming, and to sit there with the other women and to look up and I say, yep, that cell 23, that's where I stayed for 4.5 months, and you can just see everything melts. They just change and they're like, oh, okay, you do know what I'm doing, so anyways, like I was saying, so I am a alumni of drug treatment court, and if it was not for and again, this is almost a decade ago at this point, and so the resources that are here now were not even a thought. I learned about peer support when I was in treatment 9 years ago. It was kind of a thing, and so to be able to have the drug treatment court support me, they paid for my halfway housing. So I was in an affordable, respectable, ethical, safe recovery housing here in Asheville. And they helped pay for that. They helped pay for my dentist because I really needed to get some dentist work that I've neglected. They paid for my peer support training. And back then it was a lot more expensive than you can get it now. So they really taught me. It was the first time in 15 years of being in and out of jail, in and out of jail, in and out of jail, that somebody outside of my family believed in me and wanted to see me succeed. And through the halfway house, I also gained that my community, my fellowship. I did do 12-step programming in the beginning, and that's the foundation of my recovery. My wellness journey has evolved over the years, and so it looks a lot different too. So that's just a little bit of my background, but our total, I see a couple of questions in the chat here. Our total annual operating budget is $3.3 million. We are funded by 17 different funding streams. And so each program is funded differently and or braided funding. So some of our programs have multiple sources that we pull from. CLC is funded through, Courtney?
Dogwood, so foundation is a piece of it, and then the state injury and violence prevention branch.
And then those funds were given to the health department, or Buncombe County DHS. Then we contract with them. So they contracted with Sunrise to provide those services. We have direct funding with the sheriff's office for child support. We have a child support peer that goes to child support court and provides financial assistance similar to our other program. We have substance use block grant funds. That's our largest funder. That houses our recovery community drop-in center. And it also provides us the ability to do regional work as a recovery community organization. So like I said, we cover from Charlotte all the way west. We are in the process of direct funding with the Cherokee Eastern Band Indians. We are going to duplicate this linkage to care program in Cherokee with the jail. And so that's happening and brand new. We also have mental health block grant funding. We had the first peer operated respite house for about 3-4 years. Now there's another one in Charlotte through Promise Resource Network, which is also another peer run organization. So that's something about Sunrise. We are a peer run organization. We do not accept any kind of insurances. We don't bill for insurances. We are grant funded and donation based. And we're open for any other questions that we may not have covered.
Hi, thank you so much. I was just curious how Prism and Sunrise work together.
Well, Marilyn, you pop in here too. Let's see, about a year and a half ago, I got a call from this woman, Marilyn, who was looking for a partner that's doing this work, right? So she made several phone calls to others in throughout the state. We just clicked and it moved forward and it just happened. And so we've worked as fiscal sponsors for Prism as they waited to get their 501. And we do things like this. We just show up for Prism and Prism shows up for Sunrise, and it's a very give and take mutual relationship. Yeah. What did I miss, Marilyn?
I kind of go speechless when I
Can't hear you.
I think it's muted on the
Yeah, on the TV
computer
part.
end. Yeah.
One of the devices.
Just talk.
All right. Hello, can you hear me now?
Yeah.
So yes, so we needed a fiscal agent when we started. We started before we even thought of having a fiscal agent because we knew the work needed to be done. And if you know anything about me, you just know that just wind me up and send me forward, and that's what I do. And then we realized, oh, we need a fiscal agent. And so I looked and asked questions, and I was connected to Sue and Sunrise, and it has been an amazing relationship. They do amazing work, and they've taught us so much. And Sue runs a great agency, so we are delighted to have this relationship. And yes, we are now a 501c3, Prism is, but nonetheless, just like we're asking of all of you, we all want to work together and continue working together because it's too big for just one of us. So we are the model for how this is going to go. So I hope that answered your question. Does anybody else have any other questions in there?